How to deal with depression and anxiety. Practical tools and proven strategies to overcome stress, boost emotional health, and regain control of your life. Written by Theo Waters. Narrated by McCarthy. Introduction. Reflect on a moment when you experienced anxiety. Perhaps it was when you were awaiting the arrival of a baby, preparing for a job interview, or meeting your significant other for the first time. How did that anxiety affect you? The reality is, we've all encountered periods of panic, concern, or unease at some point in our lives. But the crucial question to ask is whether that anxiety served a purpose. You might be wondering, are there different types of anxiety, some helpful and some not? Indeed, certain forms of anxiety can be beneficial. This kind of anxiety prompts us to react to stressors and potential dangers by heightening our reflexes and focusing our attention on how to manage the situation for our safety. Once the stressors subsides, this type of anxiety typically dissipates. But what exactly is anxiety? Anxiety entails a persistent feeling that lingers, even after the intense situation has passed. You may find yourself unable to regulate feelings of panic, concern, and unease. When anxiety becomes overwhelming, it can severely impede your ability to cope with daily life events. The intensity of emotions, lasting for weeks to years, negatively impacts thoughts, behaviors, and overall well-being, causing significant distress and diminishing life's enjoyment. Anxiety manifests physically with symptoms like pain, stomach issues, and rapid heart rate, concerning many individuals. Yet its effects extend beyond the physical, disrupting coping mechanisms, relationships, and work performance. Unchecked anxiety can escalate into depression as their symptoms often intertwine, though they remain distinct conditions. Fortunately, they share similar treatment approaches, prompting their joint discussion in this book. Occasional feelings of sadness or stress are normal, but prolonged distress can evolve into mental health disorders, underscoring the importance of timely intervention. Anxiety may serve as a clinical marker for depression, while depression can stem from various anxiety conditions. However, both conditions typically respond well to appropriate treatment strategies. What is anxiety and depression? Is there a distinction between fear and anxiety? What about worry and anxiety? Additionally, how do anxiety and depression differ? And where do emotions like stress fit into the equation? Have you ever contemplated the meanings of anger, terror, dread, or nervousness, and how they intersect with anxiety and depression? It's important to recognize that a significant hurdle in addressing anxiety is the lack of clarity surrounding these terms. Without a clear understanding, it becomes challenging to identify the root causes and develop effective coping strategies. To address this, let's begin by defining these terms, providing.
Sample complete. Ready to continue?